Welcome to Health Options on the Nigerian Television Authority, the NTA. Cancer is a public health problem worldwide, affecting all categories of persons. It is the second common cause of death in developing countries and represents about 13% of all deaths in the world. More than 2 million Nigerians are known to have one form of invasive cancer or another. It is a very expensive disease to treat, and out of the estimated over 100 cases diagnosed annually in the country, not less than 80% die. The good news, however, is that there are good-spirited individuals who are using their professional knowledge and position in the society to make a difference in the fight against cancer. You will get to meet one of such individuals on this episode of the program. We will also bring you some medicinal plants with anti-cancer properties on our Nature's Corner. Thanks for joining us on the program. I am Rabi, Abdallah. This is Health Options, and our focus is on cancer control. And I have with me in the studio an individual who has for some years now taken it upon herself to contribute her quota to the fight against cancer in a unique way through her foundation. I'm talking about Her Excellency, the First Lady of Kebbi State and founder, Medicaid Cancer Foundation, Dr. Zainab Shinkafi Bagudu. It's a pleasure to have you on Health Options, Your Excellency.
Thank you very much, Rabi, for inviting me today.
Really good to have you with us.
Nice to see you again.
Same here. At the mention of cancer, I've known it. I know it's something you've had the passion for even before you became the First Lady. And I know you're a pediatrician by training.
Yes,
why the interest in cancer? At what point it didn't dawn on you that you really have to step forward and make your own difference?
Well, as a pediatrician, one of the main people that you come into contact with after my initial principal, who are the children, is the mother. Okay. And when in the course of my professional work looking after children, I started working in Nigeria in Garki Hospital, and after my training as a pediatrician, and I come into contact with my patients, the children and their mothers, and one of the common things they started to ask me about was about issues to do with their breasts. And I realized that there was very little knowledge and awareness about things that have to do with the female breasts. And from there it gradually grew. So I always say this a lot. I didn't set out to do cancer advocacy. I didn't set out to do cancer diagnosis or treatment or set up a foundation in cancer. I didn't go looking for cancer. Cancer found me. It was as a result of the need of people around me. Breast and cervical cancer are the commonest cancers that we have in Nigeria, and they're the one they affect women. The breast and the cervix are parts of the female anatomy. So the women, the mothers of my patients, naturally would come to me as a woman and also discuss breast issues, cervical issues. I'm not saying they necessarily had cancer, but it slowly dawned on me, quickly in fact, that there was a huge gap in the health system that to cater for these women. There was nowhere for them to go to seek easy information about these things. So we gradually built up a center, a Well Woman Center, to cater for these type of issues, and the foundation grew in that way.
Okay, I know that there are some sociocultural practices that inhibit access to treatment and all of that, even the aspect of prevention. And as a woman, I haven't seen the magnitude of this disease that people say is one that puts money to shame, and it's just something nobody will wish even on his worst enemy. You've seen it all there, out there. What remains that critical, aspect of it that you think the country needs to really rise up and address?
You've said it all again. It's the main thing that is hindering us in not just Nigeria, but in low middle income countries, of which Africa is the main place that we need to concentrate on. And Nigeria is a huge chunk of Africa, is lack of awareness. And that lack of awareness is what is causing the big problem that we have in cancer. Most cancers are treatable. Most cancers can be prevented, but that can only happen if we detect it early. And for us to detect it early, we have to be aware. We have to believe in ourselves that these things are not caused by witchcraft. It is not abnormal. It is not some spirit. It is not something that if you go to a traditional herbalist is going to be cured. It's not something that is a portion that somebody has a spell. And if you go to a hospital, you can get a cure for it. So these are the things that we need to tell ourselves, or that even that lump, a lot of young girls that don't even have that misunderstanding, they don't know what the lump means. So we have to teach our daughters, we have to teach the young people what the lump means, and those are the awareness, the low-hanging fruits, the prevention that we can sort out.
Let them be able to understand that there isn't supposed to be a lump in the breast.
Exactly.
And when you notice a lump in the breast,
you go to a health facility, you go to a health person that can help you to figure out what is this lump exactly. Is it cancer? Is it not? In most young girls it is not, but it has to be checked. We have to understand. And then there is the vaccination issue. A lot of smaller African countries are now giving vaccination free, and that's where we have to go to the government level, where we call on policymakers. And
you're referring to the HPV
the
vaccine
HPV vaccine for cervical cancer.
Okay.
That is one cancer that can be eliminated. Australia is on course to be in the first country in the world to totally eliminate cervical cancer. The vaccine was discovered by an Australian, and we have countries in Africa now that are giving the vaccine free, and they are also on course to eliminating cervical cancer because they are giving young girls and boys this vaccine. So we need to start looking at options like that in Nigeria to include the HPV vaccine against cervical cancer in our vaccination schedule.
Okay, for even those who have the awareness regarding cancer prevention, for those who do self-breast examination and other screening, and somehow for when cancer is diagnosed in a human being, be it a man or woman, especially with female folk, well, now looking at the fact that it's a disease that is so expensive, like I mentioned in the opening, and it's not something that out-of-pocket expenses can take care of. And I know you have been at the forefront of the advocacy that has to do with expanding the NHIS to cover, go beyond the certain aspects that are covered, where cancer diagnosis is concerned. Well, how far are we making progress in that regard?
Yes, we're making progress in that regard. There is the NHIS has just recently taken on board some form of cancer treatment under its cover. So we are very grateful for that, and we congratulate them for that, and we're very pleased about that. They're now going to cover some diagnostics, some surgery, and some chemotherapy. Wow, but of course, we're human beings. We want them to do more. But the cancer space and the cancer societies, all of us, civil society, we're really very happy about it, and we're grateful. But there's a lot more to be done. Also, we're grateful to the federal government, I would say, the pharmaceutical companies. In the last 5 years, the cost of chemotherapy has come down significantly. We now have some functional radiotherapy centers. There are 2 in Abuja, 2 in Lagos. So where there's some improvement in the facilities that are available. It's not there yet, but it's not unique to Nigeria. Worldwide, there's a shortage of at least 5,000 radiotherapy machines. Most of these 5,000 need to be in Africa. Yes, but there is a shortage. So we're doing something. It's not like it's getting worse. It's there's some movement.
We're making progress.
We're making
we
progress.
Might be slow, but at least we're getting somewhere. Good to know that. That takes me to the next question, which has to do with your own unique way of fighting cancer. The kilometer walk. How many kilometers this time around? I'm aware of 5 kilometers. Are you?
It's 7, but we call it 5 because people get scared.
Okay.
And they push and push and push, but it's a 5-kilometer walk.
Okay. Walk cancer away.
Yes, we walk away cancer. The idea behind it is quite a few things behind it. The first thing is it's exercise. It's promoting a healthy lifestyle. One of the major ways in which you can prevent chronic diseases, not just cancer, is by living a healthy lifestyle, by which means you exercise, you eat the right kind of food, avoid red meat, avoid highly unsaturated fats, eat vegetables, fruit and fiber, avoid smoking, avoid drinking, and then also exercise. So we lead by example. We have high advocates, community influencers, policymakers, celebrities. They join us to lead by example. Then secondly, it's a fundraiser. We sell all kinds of walk paraphernalia, t-shirts, face caps, hijabs, whichever one picks your fancy. Pick one up, join the walk, and all the funds that are raised from that goes towards helping indigent cancer patients. That's one of our major ways of raising funds. We ask corporate bodies to sponsor the walk, and again we raise funds from that. And then of course there's the whole awareness that the walk brings. People see us in Abuja making noise. It's a very big event now in Abuja, and they see us, what are you doing? What are these people doing? Oh, cancer, this cancer again. And all through the month, that's why I'm here. Now we're talking. Last month I wasn't here, but now we're talking about cancer, the things that causes it. What can we do to prevent it? We call on policymakers. This month in particular, we're talking about exactly what you just mentioned, which is including and expanding cancer care under the insurance cover. And we had very good response to that, thankfully.
Okay, it's been 6 years down the lane now that you started this laudable cause.
It's 12 years.
Wow, 12
years.
My God. Oh my
you were
God.
at one of our functions at
A-class. Okay. I remember. I'm so sorry for the misinformation. I remember now. And I'm just wondering, at what point will you just look up, towards the sky, and have a sigh of relief and say, oh, I've gotten to where I really want to take this initiative to?
At the point where every, should I say, 12-year-old Nigerian girl knows that she needs to do a breast self-examination. At the point where every 45-year-old Nigerian woman can walk into a public hospital and get a mammogram and a pap smear free. At the point where every 60-year-old Nigerian woman that is diagnosed with breast cancer or cervical cancer can walk into a public hospital and get her treatment free of charge on her health insurance scheme from the government. At that point, I'll put up my head and go to sleep. I'll put down my head and go to sleep on my pillow. I don't know if I'll see that in my lifetime, but if I see one of those, then I'll be pleased. The girls one, I think that is possible. I think we can do that. It's a low-hanging fruit. Awareness, prevention, and education is very important, and we do so well. One of the most successful programs that I run in Kebbi State is the school health program and the traditional rulers program. Those two, they kind of work hand in hand, and it's very successful. We go around schools. We have school health clubs, the same after school club, and then I also go, and they're very enthusiastic. They like it, and we teach them about it. And not only do you get to teach them, you mentor them, you serve as a role model to them, and they listen, they learn about it. We do educational materials for them, books and so on, and they take it on board. We wanted to call it a cancer club, but it was rejected, so we called it a health club, and through that we have been able to introduce, which at the end of the day, it was a good thing that it didn't pass as a cancer club alone, because we can introduce different health topics. We do menstrual health, we do sickle cell, and it's been very good. The traditional rulers program is another one, because as we know, we are Africans. Once we get our royal fathers on board any topic, we're able to use their influence to influence the community, and then we can get the ideas that we want to sell to them very easily accepted.
Wow, so it's about a synergy between being a medical doctor and prioritizing humanity here.
Absolutely. Well, yes, humanity as a doctor, you have to be human. It's your first calling. You have to be human.
So it does pay to have a first lady as a medical doctor, who is a medical doctor.
Well,
to say that.
Anyone can do it. The humanity comes first, okay. I think, if you're going to be a leader.
Your Excellency, thank you so much, Dr.
Zainab. Thank you for having us, Rabi. It's always a pleasure to see you.
Thank we look forward to you realizing your dream so that you can go to sleep.
Amen.
Thank you so much for coming on Health Options.
Thank you for having me.
All right. You are watching Health Options. We now take you to our nature scanner, where you get to see and know some medicinal plants in our environment that contains anti-cancer properties.
I want to start with this very popular plant. This is called Cucuma longa. Cucuma longa, this is the popular turmeric. This is the turmeric rhizome, and it's very popular. In fact, if you go to stores, supermarkets, you will see turmeric powder, in different forms. It's a very good spice. Its origin is in India, and for more than 2,000 years, Ayurvedic medicine has used preparation of turmeric preparation in the treatment of cancer. In as much as turmeric is known to have a history of strong anti-cancer property, isolation of chemical constituents such as curcumin has proven to be a challenge, because that constituent now had reduced anti-cancer property. Some of the things that we are doing in the lab currently to ensure that these challenges are overcome include trying to enhance the bioavailability, which is the problem of the curcumin itself that has been isolated from it. The second plant here that you see, this is leaves of soursop. Soursop, if in fact these days, if you go on social media, you will see a lot of people posting things about soursop. Just drink soursop and your cancer is gone. Just make juice of soursop and you have no cancer again. The beauty of soursop is that while it is true that scientific studies have proven in the laboratories that it has the ability to kill a lot of cancers, different types of cancers, it is not true and it is not advisable for anybody to start soaking soursop fruit or making juice of soursop and drinking it thinking that it's going to kill cancer. You are just deceiving yourself. It does not kill cancer that way. How will it kill cancer? It will kill cancer when we all cool down, when we make research and development an agenda for our nation, when we begin to invest into research and development. There are a lot of studies already from our laboratories to show that soursop has phytoconstituents that can kill different types of cancer. This flowering plant is called rose periwinkle. The scientific name is Cantharathos roseus. This plan, in fact, two powerful anti-cancer drugs have already been isolated from this plan. They are called vincristine and vinblastine. They are chemical compounds and they have very serious side effects. The difference is this, and this is what we preach about nature, and this is what we want to emphasize about nature, and this is what we want to emphasize about pharmaceutical research and development to herbal medicines. We must go back to nature.
The breast cancer also, for prevention of breast cancer, self-breast examination is very important. Breast ultrasound when an individual is less than 40 years, and when an individual is more than 40 years, mammogram is very important so that when detected early, it can be cured at that particular time. By the time an individual go to a hospital and she do a mammogram and they say the mammogram is normal, it assumes that the patient can come back between 1 to 2 years to repeat it again. But when they say there is something inside that they find it benign mass in the breast, it will be wise for her to repeat the mammogram after 6 months. But once it is done and there is nothing found in the breast, it will be wise for her to repeat it between 1 to 2 years because of the risk of radiation. By the time you are taking a lot of fats, it will reduce the time that someone will go to the toilet, and that one will make the stool. It will make the stool, one, to be harder, one, to be static in the body system, and patient will be constipated. And constipation is one of the long-time constipation is one of the risk factors for cancer of the colon and also anal cancer. Cervical cancer can be prevented and also can be detected early when a patient is comes to the hospital for pap smear, screening of pap smear. You know, when a patient is in the hospital, they will screen her for pap smear, and if detected early, that is what they call carcinoma in situ, which that mean that when it is carcinoma in situ, it's an early cancer, and it can be, at that stage, it can be cured. For the male, to always screen for cancer of the prostate by doing their PSA test. That one can be done once every year. They should do abdominal ultrasound. That should also do exercise is very good for the body. That will reduce a lot of risk of exposing an individual to cancer. And also for the female, also I'm urging them to do self-breast examination. And also for the cancer of the colon, especially those that have family history, that is what they call fecal occult blood test and also colonoscopy. The people that have cancer of the colon, family history, they should please urge to do that from time to time so that they will reduce the risk of exposing themselves to cancer.
And this is where we wrap up this episode of Health Options. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi, Abdallah. Thanks for watching. Bye for now.